And what I've asked 4 of our faculty to present on their current work. I selected them because they are what I consider the future of the department, the sort of age and developmental stage where things are really going to be the leaders in the next 10 years. And our first presenter is Susan Sherman. Susan is a graduate of the school 14 or 15 years ago. 14? Whoa. Still worried about age. I've worked with Susan around the world. She is a social scientist by training. We've worked together on a variety of intervention trials in India, in Thailand, and she's doing a really, I think, exciting, high-risk project here in Baltimore City. So without further ado, Susan Sherman.
Thank you all. Thanks, David, for the invitation, and thanks for coming on this lovely day to sit in our lovely room. There we are. The ship, the dark room. Okay, so who would have thought you'd be coming to this day on epidemiology and start by hearing about exotic dancers, but you are. This is actually a picture from the Block, which is nearby. How many people have heard of the Block? So most people have heard of the Block. It was established roughly 70 years ago, and hopefully by the end of this slide you'll know why I'm talking to you about this today. It was established around 70 years ago. It used to take up 4 to 6 blocks, and over time, particularly in the 80s, when the economy shrunk in the city, the block shrunk and is settled to about 1.2 blocks, 1.5 blocks. It's comprised of 20 adult entertainment establishments, mostly strip clubs, some book clubs, and other bars. And it's located 1.2 miles from where we're sitting, which is kind of startling, but the more startling fact is that the Central Police Station, a very old, big, ominous building, which is the Central District of Baltimore, anchors one side of the block, and then parallel the street next door is City Hall. So, and why are we talking about this? I do HIV research with high-risk populations, drug users, and sex workers, and the reason that it has significance in my world is that it's geographically very concentrated. The dancer population, of course, there's no real census, but we think it's around 300 women at any given time. And there's a high turnover, as I'll show you. And there's a lot of HIV risk that's happening there. So in February 2008, the head of the Needle Exchange and I do a lot of kind of unofficial research for them, with them. We were called by a colleague who is a psychiatrist, and he said, you know, I have a number of buprenorphine patients who dance on the block, and there were no services being provided in this area, even though they're kind of very close to the city health department. And we talked to this woman. Chris from the health department says, you know, it was the hour we were the most quiet when we together. We just kind of sat there with our mouths ajar listening to this woman. She drew us a map of the clubs, the demographic composition of the women who danced, and each clubs and the types of drugs that were in these clubs. So faster than the speed of light for health, the health department, within 4 months, there was a needle exchange van that is still there exchanging syringes and giving out condoms. Once a month, there's an OBGYN nurse who comes and gives depot shots and does exams on another van. 10 to 1 a.m. on Thursday nights. It's the most popular volunteer spot of the needle exchange. We started with no money. The health department gave some money for compensation, doing a quick survey in the last half of 2008 to try to see what exactly was the nature of risk. When you talk to people, everyone knows, oh, lots of stuff happens down there, but no one had ever quantified it. And then we received a small bit of money from NIDA to do some in-depth interviews as we realized the nature of what was going on. Women were 18 years or older. This was the inclusion criteria, and they needed to have danced on the block. And I have to say, it was an incredibly non-random sample. Mostly it was people who came to the van. We started to get more in the clubs as the needle exchange was more established there, because in this first study, we really were seen completely associated with them. And by the ethnography, we did a lot of interviews in the clubs. We had access to clubs. So when you look at this, although I think that this is fairly characteristic of some of the women on the block, it's a little bit skewed. So who are these women? Average age of 24 years, predominantly white, which is true, 57% graduated from high school, and a median monthly income of $2,000. 53% reported that. So if you really, is that risky? I mean, that doesn't seem that risky. But if you look a little bit further and think about the stability of people's lives and their vulnerabilities, 61% reported having moved twice or more a year, and that's fairly disruptive. Most 3/4 had been arrested, a lot report of heroin, crack, or cocaine, and 42% of women reported sex exchange. And we know that it was higher, but that's who reported to us at this time. We now are working in a broader range of clubs. I'm going to tell you a little bit about that recent work, but this was all concentrated in pretty much, I think we had 8 women came from 8 dance clubs. There was a nonprofit that was doing HIV and chlamydia testing, and among the women who they tested for HIV, the prevalence was 1.5%, and chlamydia was almost 14%, and that's fairly high. We don't know if they were dancers, but presumably they were mostly dancers. So we started to become really interested. What was, these environments felt so risky. All but one woman started selling sex, reportedly started selling sex. She came in selling sex, but everyone else started while they were working the clubs. And almost 2/3 of people reported starting heroin, crack, or cocaine when they were in the dance clubs. And in multivariate models, looking at sex exchange and crack use, starting these behaviors in the club, drug use and sex work, were significantly associated with these risk behaviors. So there was something about the nature of the environment which led us to get a small pot of money from NIDA to do a little bit more risk exploring the environment. So this was our qualitative study. We had 40 interviews, 25 were with dancers, and 15 were with other staff, bartenders, doormen, managers, one owner. They were taped and transcribed verbatim. We had copious amounts of data. The interview were conducted by 3 amazing graduate students. We conducted the interviews in the clubs, as I mentioned, in cars behind the needle exchange van, sometimes in subway, which was on the block, always private. And both these studies, of course, were approved by the IRB. I am on the IRB, and I think these studies are what got me on the IRB because it was just very tricky. And I went twice to talk to the IRB. You can only imagine the level of risk and concern with sending out staff into these kinds of environments. The only way that these studies would really work would be going into the community. But we have a lot of protocols around safety, and we never go out alone, et cetera. There are lots of things that go on in the clubs that we don't want to see and can't see, and so I am the go-to person for really high-risk studies on the IRB. So I'm going to give you a little bit of our qualitative data right now, but first I'm going to talk about this notion of the risk environment. So Tim Rhodes is a sociologist at the London School of Hygiene, and he, although this concept from many years in social ecology of looking at the broader environment in which systems, people are embedded and animals are embedded in systems, he really articulated this risk environment for injection drug users. He does a lot of work in the former Soviet Union, and defined it as either the space, either social or physical, in which factors increase the risk of harm occurring. It really emphasizes the primacy of context and structures, so laws and policies and physical space and social interactions, and takes the focus off individuals and behaviors and looks at solutions and risks in a broader environment. So it's a really important, and lots of people in the social and behavioral world talk about environmental risk, but it's something, it's really hard to study, and particularly in the social sciences and the work that we do, it's hard to quantify, and that's actually what we're trying to do now. But I'll show you some of the qualitative data that informed what we're doing now. So taking his conceptual framework and the work that we did of these interviews, we explored the physical, social, economic, and policy domains. This was a paper that was published in Social Science and Medicine. So the physical environment that might engender risk is secluded rooms used for selling sex. Social would be the lack of condoms in the clubs, or the fact that they used to sell condoms before the needle for $1 to $2 before the needle exchange was giving out thousands for free. Payment negotiation, you'll see that the bartender negotiates all payment. The women actually have nothing to do with it. The norms and expectations about selling sex, so that's a part of the social environment. Economic environment are the economic incentives to sell sex versus not in this club. And incentives made to the dancers, what the expectations are for the clubs, and then the policy or club rules and kind of norms. Women can't leave the clubs. A lot of, they use drugs on their shifts, doormen or runners. I mean, there's a lot of environmental policies that actually escalate the risk of these women. And I'm talking about HIV risk and drug use risk. So in thinking about and asking women, why did you start selling sex? I wasn't making it, $30 a night and paying my bills, said a 24-year-old. So I had to step up the pace a bit. And then I saw how much money I made. And I was like, walking out of the club with $30 or walking out of the club with $700, big difference. I will say that this was 2008, and if you talk to people now, no one walks out of the club with $700. She was kind of exaggerating. I don't think, women, they had this number in their head and they kept trying. They definitely made more money back then. People have a very interesting, they can talk to you about the economy and how, they're kind of on the bottom of the budgets of men's budgets. It's the first to go, so they definitely are susceptible to bad winters and bad economies. But they definitely make more money from selling sex than from just dancing. So in asking a woman, why don't you leave? This place is like a vacuum cleaner. I think right now it's actually because I can't find a job that pays me the money I make here. I can't make money like this anywhere in the world enough to pay my bills, and that's the God's honest truth. Has anyone ever bartended or waited tables? A few people, 2 people, including our chair. Thanks, David. You have cash every night. It's a very different thing. If you work at night, you get off late, and there's this world that works at night, and they get up late. These women live in an alternate universe. It's really unbelievable. I'm going to tell you a little bit about what we're doing now, but they don't even know how to show up to their shifts on time, let alone to our interviews. They just, they don't, even though they work, they get in a lot of really bad habits, and you throw a drug habit on top of it, it's very hard to leave. Can't even imagine living 2 weeks with one paycheck that you have to save over time when you're used to getting money every day. So it truly, sadly, is like a vacuum cleaner. And as one woman said, drugs are the glue that keep me here. It's just very hard to leave. Where else in your workplace do you get heroin and crack? Hopefully not many places. All right, so who's putting pressure on you to sell sex? The bartender a lot of times will try because he gets money every time you do anything. A lot of bartenders force girls to do bottles. Everything is recorded in their books as the number of drinks they sold, so a bottle is actually a transaction where a woman goes into a back room with a man. I have to say it wasn't, so this is 2009. Lately, our being down there, they are basically brothels. They are completely brothels. I don't know why it hit me the last few weeks how it's just amazing to me that these exist. The risk is really out of control, and they're under the nose of the police and that's a whole nother talk, but who come in and out of the clubs, in and out of uniform, and there's nothing that can be done. I do other work with police, and some say we'd love to just blow up the block, but they pay taxes and they contribute to political campaigns, and this block has been around for a very long time. Not in its current manifestation, except for the past 20 years, the degree of risk that happens there. So asking another woman who's putting pressure on you to sell sex, it's a mix of people, like the bartender and the customers. The men expect stuff. They don't expect to talk to an 18-year-old girl paying $20 to just talk to you and not touch you. The only thing women can negotiate is their tips. And so, of course, when they're sitting and having a $20 drink, which the man pays, she gets $2 to $4, depending on if she makes her a very complicated matrix of payment. That includes base pay, and it's very confusing how their payment system, and most of the women don't understand exactly how they're paid. But if she can negotiate more for their paying less, she does. So there's this constant tension that sometimes she puts herself at greater risk or does things because that's the only way that she can negotiate any funds. Okay. So we were really interested in, how do women survive down here? They're very tough work environments. And we looked to see the average length, how long were people lasting. So in the quantitative study, for the 15 that were there less than 6 months, they were there on average a month. But the women that were there longer than 6 months, they were there 48 months. So there's a big gap of people who come in and then, people leave, and then women are dancing there for a very long time. And I became really interested in this notion, if people have limited opportunity, they go to a place, an environment like this, and over time it increasingly escalates their vulnerability to HIV and other morbidities. So we wrote a convincing grant to NIH to do a more proper study, as I said, not just of the block, but other dance clubs in Baltimore. We've 26 right now. We've been in about 30. And the study is a feasibility study of this risk environment. You know, for NIH grants, we couldn't use sex workers, so they are vulnerable women. That is a kosher title. And the study, a staff person came up with this. She got a nice gift certificate to Pazzo for it. The Stiletto study, studying the influence of location and environment, talking through opportunities for safety, because we love our acronyms, right? So this study, the first aim is to develop a measurement tool to characterize the risk environment. So lots of people talk about Tim Rhodes' risk environment, but there are very few quantitative measures. So along really 5 domains: social, economic, drug, policy, and physical, which we did from observations. But for the social, economic, drug, and policy, we created an anonymous survey. We went into the clubs with a tablet. There were 65 items that populated those 4 domains, and it took 15 minutes. We interviewed staff that had been working longer than 6 months. And I'll explain why in a minute. We basically found that we created this, and these are some examples from the social environmental risk index or domain. The management pressures to dancers to sell sex, so people answered from strongly, agree to strongly, disagree, a 4-point Likert scale. Dancers talk to each other about condoms with customers, so that obviously goes in the opposite direction, because the higher the score would mean safer. And so we found these to be very reliable. We're in the process now of doing factor analysis, confirmatory factor analysis, and looking at a range of psychometric properties off of these scales. But from this, we created a list of the clubs. We had 26. We had enough of an N in each club. We felt to go back. There were enough dancers for the next part of the study. And we ranked them from least risky to riskiest. And it was really interesting because it really matched our staff's experience. So even if we know people weren't going to tell the truth all the time, we were asking them to even anonymously to admit to illegal behaviors, the rankings panned out. And you can imagine we have an amazing committed staff. This is very intense and rewarding work, but we've had great women working with us. We actually are hiring our first 2 men to go out and do field work, so that will be interesting. So the next aims of this study are to enroll, recruit, and retain new, meaning dance less than 6 months, female exotic dancers in low and high-risk environments over time to test the feasibility of a future larger, hopefully, intervention study. We had high hopes in the beginning of doing a much bigger trial, and the reviewers of our first submission felt that we needed to really prove we can work in this environment. And it's amazing. They were smart. It was a good investment of an R21 for us to really prove ourselves, because it's the recruitment we're doing now is the most challenging that I've done thus far in this environment, because we're asking women to do an hour interview. We're not interviewing them on the spot, and we're doing STI testing, and they're hard to catch. We also then this third aim is to qualitatively and quantitatively explore the nature of entry, so how they got in, how they continue to work, and looking at the initiation and escalation of selling sex, using drugs over 6 months. So we're interviewing them at baseline and follow-up. And just to end with a little bit of the challenges of working in this place. Lots of people in Baltimore work with drug users. Dave and I have worked with thousands of drug users, injection drug users, methamphetamine smokers in northern Thailand. We work with sex workers in India. I've worked with street children in Pakistan. It is really hard starting something new with a population who's not used to being in studies. On the one hand, and they are drug users, so they've been in other studies, but it's really interesting working in the field and being so field-based. It's challenging. There's a lot of ground that we're breaking. These women don't even write down, we'll try to someone recently said it was amazing. No one keeps a calendar, like, oh, I can't meet then. I think I have a dentist appointment. I mean, I can't imagine not looking. I haven't looked at my iPhone now for, 16 minutes. Right? We're attached to these things. So there are lots of ways that we are breaking ground, let alone all of the work that it's taken to establish trust and be in the space down there, which I'm going to speak to in a second, but just even working with the population who's not used to being in a study, giving us all this information so we can follow them up. gaining entry. It's not just managers, it's the bartender at that moment. We went a few weeks ago to a new club where we had been in phase 1. The staff person forgot to read the notes to see that they needed to call a manager in advance, annoyed the bartender when she walked in, and he said, "You can't come in here." Then called the manager, and of course the bartender didn't like that he was showed up, so then we can't go back to that club for a little while. Gaining entry happens almost every night we're in the field. We've been in the field for 6 weeks with this phase, and we have done 12 interviews. We've been blown off 10 other times that we go to women's houses to interview them, and they're not there. So we're learning a lot, and we feel like the summer's going to pick it up. We're actually going to try to have now 2 male interviewers. The value of their time. Most studies with drug users in Baltimore pay $45, $50. We had started out with $45. These women work, and in their mind, they make a lot more money, and $45 did not speak to them, and so we just increased, I'm almost embarrassed to say, to $80 compensation. I wanted to go incremental, but my project manager said no, and it's picked up a little bit. So I'd never worked with a working population, paying them for interviews, and $80 seems to resonate more than $45. And I think that I've mentioned their lives are very chaotic, so we have to be very fluid and nimble in reaching them. And they're incredibly appreciative and interested in what we're doing. We've made a lot of referrals. We have a great resource manual. And of course, we have to keep our eyes on the prize of ultimately this will be for an intervention, whether it be we're starting a series of community workshops. We're just going in the field with a flyer asking women what are the types of topics, how to get health care, having a lawyer come and talk, financial management, financial literacy, one session on literally their online banks you can open up without ID. So it's hard to be in the field with people that have so many needs and not to give them things. So this is our way of giving back a little bit, but also really important for us to remember that the prize for us is doing an intervention, even though we can't really do anything for the women that we touch right now necessarily. All right, so I am going to end thanking a lot of people who have helped in this process, and hopefully if you come back in a few years, I will have more to say about this work. Thank you.
This is not a question, but just a comment on what you're doing for these women. These are some of the most forgotten, overlooked, hidden people in society, and I think it's probably meaningful to them that someone from the outside world even cares that they're there and attempts to bring any type of service to them and is working on keeping them safer in their work.
Yeah, no, they appreciate it. They seem to appreciate it. And they like to talk. They get that they may help another woman who's kind of coming along. Thank you.
Hi, this is probably a dumb question, but why can't you use the word sex worker at NIH?
Public health is political. Kind of in the mid-90s, David's work, a lot of people's work actually got on lists. There were congressmen who were looking into the nature of how we're spending our tax dollars, and it's just a really easy newspaper line to see that we're spending money teaching men in San Francisco. That was how to safely, HIV prevention without using a condom. That was got a lot of press in the summer, one of the summers in the early 2000s, so that's why.
This is fascinating. It's a treat to be able to see more about what you've been up to. And I just wondered you alluded a little bit to the bartender role, but I wondered a little bit whether you've interacted at all with managers or owners of the clubs, and if you've had any exposure at all or opportunity to talk with them, and if so, the degree to which they're interested or potentially invested in making structural changes or,
Right.
understanding
Right.
what you're doing, or are they invested, and what's their reaction to the work?
Well, by letting us in the door, they're mildly invested. So and that's a great question. A lot of the times the bartenders are managers. Many of the bartenders who are women have danced, so they have empathy for the dancers. We never threaten their bottom line. They don't come in there and think, if they smell that we want to change the way they do business, or we think that sex should be, sex probably is always going to be sold there. We just believe that women, it should be safe, and of course that women should have rights, labor rights. Most lawsuits in these clubs are around labor rights. It's interesting. In DC and Baltimore, there just were a few lawsuits where women were back paid hundreds of thousands of dollars because they're not really paid. Like I said, it's very complicated. So for them, they feel good because we say we're going to give them health information, we're going to teach them financial literacy, things that aren't threatening to them. And we have, I have great staff. Thanks.